Hi, I just had a double procedure done on my sinuses yesterday. I had polyps removed and I had a septoplasty done. I'm about to put the new bandage on my face. I haven't secured it completely. I wanted to show you at least what I look like without the bandages and maybe take a look and see if there's any swelling on my nose. So this is the real me. Now I'm going to put on some fresh bandage. And the purpose of having the bandage is to catch the drainage that I have coming out of my nose. I don't know if you saw, but my face is really red here from all the tape. I have an incredible amount of drainage. Okay, so what happened to me yesterday was I went in and had polyps removed out of my sinuses and I had a septoplasty. I had polyps all in this area right here and in my maxillary sinuses and my frontal sinus here. Come to find out, I don't even have a left frontal sinus. I wasn't born with one. Something new I found out about myself, kind of strange. But I seem to be okay without it. So I have 7 sinuses and they took polyps out of them yesterday. And when they did the septoplasty, what they did was they went up inside my nose and they trimmed out a piece of cartilage so that it would make my nasal passage wider, so it would be obstructed, so that I would drain better, which would result in less sinus infections, which is something that I've had recurrently, and so that I would breathe better. So to start with, yesterday I went in with a new device to me, which I'm sure is not new to the ENT world, but to me it was. I went in with a automatic registration headset for image guided surgery. It's called InstaTrack, and what that is when I first went in and got my MRI done, I wore this headset, and the images were actually loaded into the headset for my MRI. And then I wore the headset into the surgery also. And what it does is it creates a satellite connected roadmap for the surgeon to operate. You know, he could see see a screen and it's guided imagery, and he has a whole roadmap which he could look at instead of like peering down my nose and just, you know, venturing slowly. And it makes a much better roadmap for him to work from. So that's how the surgery went. They used something called a microdebrider. A microdebrider is a tool that it has oscillating blades on the end, and it cuts and sucks at the polyp pieces, and that's how they're removed. Whenever I came out of surgery, the pain was tolerable. I was really freaked out before. I was really nervous. I was worried. But the pain was completely tolerable and bearable. And they adjusted my pain meds when I was in recovery until my pain levels were fairly low. And they've given me pain medications. I'm on antibiotics. I'm supposed to be misting my sinuses 4 times a day. No irrigation, just misting. I guess they don't want anything too rough up in there. They don't want me to start bleeding right now. I am pretty miserable right now, but it's not really due to that much pain. There is some pain, but it's a lot of pressure. I'm not supposed to blow my nose, because if I do, I could start to bleed, and they will have to pack my sinuses, and I don't want that to stop the bleeding. So I'm not supposed to blow for a few days, and that's the miserable part, because I guess there's a lot of maybe blood clots and you know, some sort of surgery debris with blood clotting and drainage and things like that in my sinuses. And they said that the second day would be the worst, because that's when you feel the swelling. The swelling really starts on the second day from the cutting and the pressure. So the pain isn't that bad. I'm glad I had it done. I'm willing to go through this, because the pain that I had before with the pressure from the polyps and the inability to breathe and the sinus infections, I'm really hoping that this will alleviate that. If you're considering having this done, I could say don't be afraid. Just get a good ENT. There's a lot of good ENTs out there. There's a lot of really good technology out there right now, and I think you'll do fine. So I'm just looking forward to gradually getting better day after day, and I'm just very happy that I had this done. So here I am again with my red face, and this is the real me, and maybe in a few days I'll be much clearer. Swelling will be down, I'll be a lot happier. Alright, that's me. Good luck to you.